Okay, so I just left the oncology department. I had an appointment today. One appointment of many this week. Yesterday was my birthday. I turned 42. Yay me. I have been incredibly overwhelmed with the amount of appointments, surgeries, and keeping up with my business and clients, and trying to keep bills paid, and just life in general. So I told myself I was going to try and document and maybe start a YouTube channel to hopefully help somebody that's in this similar situation as I am. Again, I was diagnosed with invasive lobular carcinoma in September of 2025. It is now February of 2026. My first surgery was not completely successful. They did with lobular carcinoma. It doesn't grow in tumor form, so it kind of bobs and weaves through tissue, and it's not always visible on imaging. So it could be a sneaky little bugger, which my doctor, God bless her, and her team, when the pathology came back, still with the margins positive for cancer cells, and she was unable to get lymph nodes because they wanted to at least get one of those sentinel lymph nodes to make sure the cancer hasn't spread to my lymph nodes. She was kind of stumped, and she had told me that she needed to reach out to her colleagues to see which was the best path forward, because textbook answer to that would be to do a complete mastectomy, take all the breast tissue, and try to get, do a full lymph node removal in that general area, which I was not on board for. I am 42 years old. I have been on a health journey for the past 2 years. I've lost almost, I think, 130, so I've lost over 50 pounds. And in that time, getting educated and learning, about my body and trying to get my hormones balanced, taking my lymph nodes, all of them, did not seem like a great idea. So automatically I was like, hell no, you're not taking all my lymph nodes, and you're not going to take this reconstruction that we just did, because I think I would be devastated, if they were to do that. And luckily my doctor, she was in agreement. She said with my age, that she didn't think it was a good idea to completely, remove everything and, just be cut and dry. Let's just eliminate any issues or problems by just removing everything. So she was like, I'm gonna have to get back to you. And in that meantime, obviously I am with, many different people every day with my business. I'm a nail tech, so I see many wonderful, educated women from different walks of life every day. A lot of them being medical professionals, and I'm the sole owner operator of my business, so I've kind of built a lot of personal relationships with people, and I was advised by a few different people to get a second opinion, because in the beginning, I will say this, the doctors made it sound like, you know, with the size of my cancer that they see on imaging, and with my certain levels of numbers from testing, like them being low enough, they thought it was going to be pretty cut and dry and a simple, you know, double mastectomy reconstruction with the removal of the tumor, which at the time they thought was about 2.5 centimeters by, I think, like 1.5 centimeters, which was like pretty small. So with that being said, they made it sound like it was going to be a cakewalk, you know, and it took forever to get my pathology back, like almost a month. And when I went in for the post-op, she was like, oh, we had to send your pathology to Pittsburgh. You know, she's like, that doesn't mean, you know, anything's wrong, or, you know, there's any complications. She was just like, Altoona's lab, you know, just wasn't able to do what needed to be done with the tissue, so we sent it off to Pittsburgh. And I was like, okay, no need to worry. You know, I think she was just, you know, trying to ease my mind, you know, because they didn't know exactly everything that was going on. So where is this place? Oh, there it is. So with that, I had to wait a month, got the pathology back. She called me. She was like, Jamie, she was like, honestly, I am shocked, I am stumped. And yeah, so in that, I was advised to get a second opinion with a different doctor in Pittsburgh, and I did that. I made an appointment for a second opinion, and in the meantime, knowing getting the pathology back and the margins still being positive, I had to go see my doctor here in Indiana at the Women's Imaging Center for them to insert they called it a seed, so that when my surgeon went in to do the second surgery, she would have a better idea of where that lymph node that was biopsied early on was, so that she can kind of take tissue from that general area and hopefully get lymph nodes on the second surgery. So I had made an appointment for a second opinion, and I didn't realize, you know, so when I went for that appointment here in Indiana, that to have the seed put in, to have that lymph node marked, my doctor was like, she was like, you're like talk of the town. And I'm like, what are you talking about? Like, you know, she was like, well, we have, you know, a tumor board probably about twice a month, and you know, she's like, your doctor in Altoona, you know, has really been, you know, talking to a lot of different doctors as to your specific situation and how to move forward. And she's like, so yeah, you've been pretty popular, you know, and it's kind of a unique case because of my age and the type of cancer. So that was kind of comforting. And after she put the seed in, so that the surgeon could find the lymph node, I went home, and I had gotten a call from the doctor the second opinion doctor, And the office called me and was like, oh, we just, and this was like the day before I was to go down and get a second opinion. They had called and they were like, you're still more than welcome to come down and speak with us and get a second opinion. And, you know, that's perfectly fine. That's your right. She was like, but we wanted to let you know that, Dr. Diego, you know, is well aware of your situation and your unique, you know, your unique case. She spoke to Dr. Marley, who is the surgeon who did the double mastectomy. And just to give a rundown, because I was thinking, you know, I wasn't sure if I was going to name the doctors, but I guess it really doesn't matter. So there's Dr. Marley, who is the head breast surgeon who does the double mastectomies. And then there is Dr. Murphy, who is the plastic surgeon who does the reconstruction. She works side by side and is kind of a team with Dr. Marley out of Altoona. Dr. Clark is the breast cancer imaging doctor. I don't know the correct name, but she is the one that she doesn't do the mammograms, but she does the ultrasound diagnostics at the breast cancer center here in Indiana. And then we have Dr. Villamoria, who is an oncologist here in Indiana. I really don't see her anymore because I was doing the reconstruction, so that kind of booted her out of the whole situation, because she is just a breast surgeon here in Indiana. And I feel it's important to say this, that I refuse to have my care here in Indiana because Indiana Hospital has not such a great reputation with a lot of things. So I was very adamant about going to, you know, a better hospital. But luckily, UPMC is out of Pittsburgh and Altoona, and they have a satellite office, oncology office, and radiology office here in Indiana on the Indiana campus hospital place. So, with that being said, kind of explain who's who. And then we also have Dr. Remanini and his group, who are the oncology specialists who will continue my care after, you know, all the surgeries and reconstructions and all that. And because I am perimenopausal, they will be following me closely probably for the next 5 years. So, where was I? So, yes, so Dr. Diego's office called me and was like, yeah, you really don't need to come down because Dr. Diego is also on that same tumor board as Dr. Clark, Dr. Marley, and Dr. Chitty, if I'm pronouncing that right. It's either Chitty or Chatty. He's a cool Indian dude. He is the guy that will do the radiation soon. So, moving forward to the second surgery, so my margins were clear, the lymph nodes were negative, so now I go to see Dr. Chitty. Dr. Chitty is recommending radiation. So now I have to go for 6 weeks of radiation, 5 days a week, which is really gonna suck. Because, again, I am the sole owner operator of my business, and you still have to pay bills and take care of your house and children and put food in the fridge. So it's definitely been a challenge. But with all that being said, I know I'm like all over the place. How have I been doing? I have my days. where I'm very optimistic. I've been optimistic through this whole thing, but I've also had days at a time where like I've experienced like anxiety during Christmas time. I guess just with everything going on, like I couldn't, I went Christmas shopping twice. I've told so many of my clients this, like I went Christmas shopping twice, had the money ready to go, had the list ready to go, everybody I needed to buy for, and I'm walking through these department stores for like hours, and I end up leaving with a gallon of milk. So with that being said, I think I was struggling a little bit keeping everything kind of compartmentalized in my head, like it was all like mishmashed together. You know, racing thoughts, anxiety, worry, you know, fatigue, mental fatigue, so much. So I would say it's a roller coaster. It's a roller coaster all the way, from the day that you find out to, you know, through the whole process. I did have times after I found out, like when I got my surgery date, and when everything, like, because when everything's up in the air and you don't know what's happening and you're waiting for results, like it's very nerve-wracking and worrisome, because it's like, are they going to call me with something else? Is it going to be worse? Or, you know, they're going to, you know, God knows, you know. And the first thing that ran through my head when I found out was like imagining my kids' lives without me in it. That's what scared me. Like, I'm not afraid of death. I'm not afraid of dying. It's just imagining you not being on this planet anymore, and the people that you care about not having you anymore. Because as a mom, like, you take care of everything. Not everything, but like, you are a huge part in the family dynamic. And I happen to be the matriarch. My mom is gone. My dad is not a part of our lives. So, you know, I'm the one who makes shit happen. Not saying my partner doesn't, you know, contribute, because he does tremendously, but without spewing into that's a whole nother story that we'll talk about another time. But so far, I've been okay, for whatever okay means. A lot of ups and downs, a lot of days where like I just want to hide in a hole. One thing that has definitely kept me motivated and helped me along was my clients, talking to my clients, and you know, just even if I was not always talking about me, just hearing, you know, their stories and what they're going through in their lives, and, you know, laughing and, you know, sometimes crying, because it's a very personal space that I work out of. So it's very disarming. And I think a lot of the women that come to see me, like, they look forward to being able to just kind of disconnect and, you know, talk to somebody outside of the box. So yes, I consider myself a type of therapist also. Just comes with the territory. And in one of these videos, I'll show you guys my space and show you what I do. And I know it's, you know, I'm probably rambling on at this point, but I just did leave Dr. Remanini's office, and they were telling me that, well, he was telling me that I'm probably going to be on tamoxifen for about 3 to 5 years, depending on how I handle it. And I, you know, I worry about the tamoxifen because of the health journey that I was on. And then prior to that, what my hormones were doing to my body and my mind. Like, as women, you know, we're like taboo when it comes to being medically taken care of. So, you know, they put you on this scale from the ages of 15 to 50, and, you know, you go and get your hormones tested and they tell you you're fine, but you know you're not fine. Like, you're not okay, because, you know, all of a sudden you're freaking miserable 2 weeks out of the month. You don't want to talk to anybody. You have nothing nice to say, and you're just in a deep dark hole for, you know, days at a time. And you're like, why the hell am I feeling like this? And it makes no damn sense. So that's kind of what motivated me to start my journey, because I knew something wasn't right. And it would always happen like 2 weeks before my period. And in those weeks I would be miserable and just unpleasant. I wouldn't like myself at all. And I just, I wasn't, you know, normal. So then I found out I was I was perimenopausal. So meaning, you know, within the next 2 to 3 years, I could, I'll be going into full menopause. So there's that. And in that journey, I've learned a lot about my hormones, women's hormones, and the effects that they can have. When most PCPs will be like, oh, you're depressed, or, you know, you know, let's put you on this this antidepressant or this mood stabilizer, and then that just messes with your brain chemicals and fucks you up even more, or dumbs you down to where you're not your lively self anymore, or, you know, messes with your brain chemicals so much that you're just, you know, walking around happy all the time, or, you know, you're numbed up. I don't know. I watched my mom go through that. I watched my daughter go through that. My 20-year-old, she's 20 now, and I've never been one to want to take mind altering, you know, drugs for depression. I'm a firm believer in myself that, you know, whatever deep dark hole I'm in, I will get myself out of. So my PCP was like, you know, well, nothing's wrong. Like, you know, your levels are normal. And then I seeked out integrative health, which unfortunately you have to pay out of pocket. But at the time, you know, I was working full time. I had a little bit of disposable income, and I made the leap that I was going to pay to find out what was really going on, you know. And I found a lovely person that, you know, has been doing it for a while and had a really big passion for really getting down to the root cause of things and trying to figure it out and make your life better by making you feel better by balancing your hormones and you know, getting everything in your body to where it needs to be so that it's functioning properly. So there's that too. I'll talk about that later on too, but I just wanted to kind of get everything up to speed. I know I'm all over the place, just trying to piece this together, you know, the best I can. I've never documented it before, so please bear with me. And I will try to do this more often so that it's not such, you know, a mess. And thanks for listening. Hopefully I get this posted or a YouTube account soon, to where, you know, maybe I could, you know, just share my story and it'll kind of help somebody else. You guys have a great day. Thank you.